my mission today is to come to a shared understanding with you about what health literacy is. We hear a lot about the term literacy being used if we think about digital literacy, emotional literacy. I think I looked at something the other day. We've even got people beginning to start talking about sport literacy. So today I just want to really share with you, as Glenn said and as Doone mentioned earlier, we went through a huge consultation period, so many meetings, so many debates, so many discussions about research and which research and data that we would base some of our work on. So today I'll just share with you a definition to start off with. So in terms of the World Health Organization, the definition there is an individual's ability to gain access to, understand and use health information and services in ways that promote and maintain good health. What we've done then is we've gone and we've had a look at the work of Nutbeam. The way that I've put it here, or we're describing it, is that health literacy is more than just being able to access information. It's about being able to access information, critically evaluate the information that you have, and actually utilise that information to enhance the health of you and others. I'll just explain Nutbeam's ternary level model of health literacy. It's a continuum. So we start with a first level, which is our functional health literacy. We move into interactive health literacy. And finally, critical health literacy. So I thought today, in trying to tease it out a little bit further for you, that I'd give you some examples of what that could possibly look like in practice. So in terms of functional health literacy, if I'm then to have a look at that within an educational or an educative focus, we're talking about the acquisition of information relating to knowledge and services with respect to a health-related question or topic, using basic skills of reading, writing, accessing information. If I use an example, which was shared with me by Dr. Janet Reynolds, who is a leader in home economics, is an example there. So in terms of a functional health literacy, we'd be looking at students being able to identify on the Australian Guide to Healthy Eating and related support materials the number of serves of red meat recommended for their age group, as an example. If we were then to move further into the interactive level, we're looking at more advanced knowledge. We're looking at understanding and skills to actively use that knowledge within another context, to engage with the issue. So an example there, if we're still looking at red meat, okay, is that students are able to look at alternatives to red meat and discuss the dietary implications and how they can be overcome if a choice is made to eat or not to eat or reduce the consumption of red meat. If we then move into the critical health literacy, it's about the ability to discerningly evaluate information that you have, to take into consideration the psychosocial determinants of health and take action to promote personal health and well-being or that of others. An example being students evaluating the viewpoints from a range of sources to identify broader issues associated with red meat consumption. So we're looking at maybe sustainability issues, the impact of farming and community, economic stability, and they use this information to take action and promote what they believe to be responsible consumption of red meat. So you can see the different levels and how they're working together. In terms of developing health literacy, I've just got some points up there that I adapted from some of the work that Louise has been doing. What we're saying is that as students progress between each level, that they assume greater autonomy and self-empowerment. That the progressions between the levels is reliant upon cognitive development and exposure to information. Information being our first port of call. That the provision of learning experiences which construct and critique real-life scenarios are beneficial. That learning experiences which enable students to participate in group decision-making and critical evaluation of media and health resources are beneficial. And that important also is digital literacy, is the ability to be able to search for information, to be able to have a look at that information and evaluate it critically in terms of how reliable that information is or who the sources are of that information. A bit of a take-home message, I suppose, and it's come up before in the conversation that we were having with Glenn and with some of the others. It's very much about tailoring what it is that you're teaching to your learners, to your community, to the staff that you have within your schools. I've got a couple of other examples up there for you. So if I'm thinking about a year 3-4 sort of area around the topic of being healthy, safe and active, I've got some examples up there for you. So in terms of functional health literacy, students are able to identify reliable sources of information, whether that be people, websites, okay, that they can access if they have relationship questions. Like Alison, I did quite a lot of my teaching work in remote communities, living and working in the communities, and functional literacy or functional health literacy is very much about gaining access to information that's available to you. So in some circumstances, the internet isn't available. So you might be reliant upon the teachers in your school, the elders in your communities, parents, friends in some cases, although the information that they often get from their peers is not as reliable as we would like. Health nurses and visiting doctors that come into communities as well. In terms of interactive, so we then have students discussing different types of friendships and how friendships change as they get older. When we then move into the critical health literacy side of things, they explore how changes in friendships can impact on how they feel about themselves. They share ways to maintain healthy friendships and positively interact with others. Another example, if we have a look at 5-6, contributing to healthy and active communities. On a functional level, students are able to articulate what being healthy means and being able to identify what is termed as a lifestyle disease. When we're looking then at the interactive health literacy, they're examining prevention, treatment, control strategies for lifestyle diseases in Western culture, and then they're also making some comparisons to maybe another culture, maybe looking at that whole mind, body, spiritual links that can be made. Then when we move into a critical health literacy area, they're critiquing the effectiveness of the support groups that are available. They're having a look at current health promotions that exist for lifestyle diseases, and they're coming up with their own ideas about maybe better health promotions that would service them better or the community better. The last example is a year 9-10, contributing to healthy and active communities, and this is about food choices. So at a functional level, they're able to identify personal and social factors that influence food choice and eating behaviours. At that interactive level, they're discussing cultural and environmental factors, maybe social factors that influence their own food choices, their eating behaviours, and compare these to others. At a critical health literacy stage, they're now examining the nutritional outcomes of food choices, how their eating behaviours can affect their mood, their energy levels, social relations. They propose strategies for improving the nutritional value of their own food choices and eating behaviours. So at that critical level, there's always that aspect of what can I do about it? How can I send this message to others, advocate for the health message? And again, we have the link between the propositions. So focusing on the educative, developing health literacy, teaching with inquiry-orientated pedagogies, taking a strengths-based approach, and always remembering to value movement. Thanks.